760 WJR, where Detroit comes to talk. Sitting in today, Chris Alberta.
Well, just because you can do something doesn't mean you should. And just because you should do something doesn't mean you must. At least in America, with the somewhat of the freedom we have left. Yesterday, the FDA approved Pfizer's COVID-19 vaccine for kids 12 and older, which is kind of a step down now. And on the other line, we have Dr. Rudolph Valentini, Chief Medical Officer for the DMC Children's Hospital here in Michigan. And Dr. Valentini, talk us through why this matters, and is it a big step, and what should we be thinking as parents or grandparents of these kids that might be getting the shot?
Oh, good morning, Chris. Thanks so much for having me, and excellent question. I am very excited about the fact that we are now able to vaccinate children 12 to 15. The CDC is meeting tomorrow to give their final blessing, but it looks very favorable. So it's my hope that we'll be able to get a green light to vaccinate these children any day now. And, yeah, I think, in the state of Michigan, we have somewhere around 2 million of our residents who are under the age of 16. So technically, that's about 20 or 22% perhaps of our overall populace that we currently cannot vaccinate. So once we add 4 additional ages to that at 12, 13, 14, and 15, we should be able to vaccinate, at least increase the eligibility of about another 400,000 or 500,000 people, children who can get the vaccine. This will get us closer to herd immunity. So that helps society. From a patient perspective, it's very important that the kids get vaccinated because they actually can get sick from COVID. We have children across the state of Michigan that are hospitalized. I think yesterday we had 40 across the state that were in ICUs and hospitalized. Children's Hospital of Michigan has some of those patients as well. So we can keep these children safe. The vaccine is very effective. We know that from the adult work, and we know that now from the phase 3 trial that Pfizer did and completed at the end of March. So you probably know the results of those trials, but very, very favorable results. And I think this is a great way to keep our children safe. So looking forward to getting my patients vaccinated, and I've been encouraging folks to keep an eye for this announcement because we've known for the past few weeks that it was only a matter of time till the FDA gave the green light, and it looks very good.
Okay. So is this approval exclusive to the Pfizer vaccine, doctor, or is it across the board?
No, it is the Pfizer vaccine. That's the only one that's been tested in this age group. So again, they tested children 12 to 15. There was about 2,200 children studied. About half got placebo and half received the actual vaccine. And what they saw was 100% protection in the patients who received the vaccine. 18 in the placebo group got infected, and 0 in the vaccinated group got infected. And what they actually did was measure the antibody titers that were generated against the vaccine. And it turns out it's probably about a 50% higher or more robust response than you actually saw in those 16 to 25. So it looks very favorable. But to your question again, it's only the Pfizer vaccine. It's my understanding that Moderna is doing some pediatric studies, but those are ongoing. And so this FDA approval is for the Pfizer vaccine only.
So, Dr. Valentini, do we know why 12, for example, is the age they chose to do this at? I mean, why not 8 or 10? Is it a physiological difference in terms of the body's ability to assimilate?
I don't think that's actually it. I think that usually I've been in pediatrics for decades now. Most trials are started in adults, and then they slowly back their way down to pediatric age range. And so I think that many other trials started, and this one started in 16 and above, and then now they've backed it down to 12 to 15. And the next group that's going to be studied, I think, is the 5 to 11-year age range. Then they're going to do another one that goes from 2 to 5, and then a 6 months to 2 years of age. So I think, the younger the child, the more fragile they're perceived, at least in the eyes of the parent. And so they want to get people to be confident that the vaccine is safe and effective. And so I think we've been slowly backing our way down to infants because we've seen children under a year of age sick from COVID. And so I don't think we would get families to embrace the concept of getting their 1-year-old vaccinated if it hasn't yet been successfully and safely tried in a teenager.
Well, let me be the humble antagonist, if you will, for a minute. I have plenty of friends who are somewhat on the anti-vaccine scale, and many of them are incredibly intelligent and responsible parents. Oftentimes their argument's going to be, look, my child's immunity or their immune system, let's say, is strong enough where on a relative scale, 40 kids out of 2 million is practically nothing. Of course, the opposite argument is they could be, asymptomatic carriers and get parents sick. But I've always replied to them too, that if their immune system is strong enough, then they should have even less fear about getting the vaccine. So how do you deal with your patients and parents who say, look, I'm just not comfortable with this. Is it really necessary?
So it's an excellent question, and the truth is you just have to look at how many children are in the hospital. So as you said, 40 kids in the state that are hospitalized, is that a big deal? Those aren't just 40 that are sick this week. Sometimes, fortunately, most of them go home and are healing, and then they're replaced with other kids that get sick. So we've had numbers of children infected with COVID. Lots of them don't require hospitalization. Some of them get better at home, but they have to be quarantined and they're ill, and now they're starting to talk about long COVID or long haulers where people may actually have some problems with a little bit of what they call brain fog. And so I think some of the children are having some struggles in school. So you don't have to necessarily end up in an ICU to be impacted by COVID. But we've actually had, there have been mortalities nationwide from COVID. So some young parents have lost their children to complications from COVID, including the thing called MISC-C, which probably speaks to that aggressive immune system that you mentioned, because that's kind of a post-infectious phenomena where the immune system is it's sort of an exaggerated response to a prior COVID infection that results in inflammation of blood vessels. It causes heart inflammation, and it's very, very serious. Some of the children go on heart-lung bypass called ECMO. So I would say, it's a safe vaccine. I mean, as long as you don't mind having your arm be maybe a little bit sore for 24 hours, maybe a little bit fatigued, maybe a little bit of headache, that's a very small price to pay relative to, being in a hospital and potentially having long-term morbidity and God forbid, mortality.
Well, the way that you're framing it certainly makes it seem like it's a responsible thing to do. Dr. Valentini, we appreciate you joining the program and filling us in. I'd like to hear from all of you out there. 800-859-0957. The phone lines are open. What do you think about this? Would you be in favor of getting your children or your grandchildren vaccinated? If you're firmly in that anti-vaccine camp, we'd like to hear from you. And if you think it's irresponsible not to, we'd like to hear from you. This is a pretty personal issue. And frankly, when they lower the age, it makes us as parents with sub-12-year-olds, feel like, okay, now I have to be on the fence where before I had an excuse. Let's get over to Dana, check in on traffic. I look forward to seeing some phone calls when we come back.
This report is sponsored by Compassion International.